Dr. Joseph McCaslin was appointed medical director of the Methodist Hospital Emergency Department after Tyler's death. He has worked closely with Dr. Schiffermiller and Peascotch to implement changes within the emergency department to prevent a tragedy like this from happening again.
As the clinician, of course, you think about, okay, what could we have done differently? What happened here? Why did we not pick this up?
Well, after the incident with Tyler, we decided to look at our process of care and to see what we could do with our system to try to lead practitioners to the correct diagnosis in this setting.
Methodist has put on their intake form in the emergency room, has prominently put the aortic dissections in multiple places so that the physician does think about that. It's also part of their family history intake. You know, does this patient have a history of family history of aortic dissections? And I think that is a great first step to making sure the ER physicians are always thinking about this in the differential diagnosis.
The process that you want to have in place is that person who comes in with chest pain gets asked the question about family history of dissection or aneurysm, and that family history, if it's positive, is recognized as a significant issue and acted upon.
Has anybody in your family ever had any trouble with their aorta, with an aortic aneurysm or aortic dissection, do you know?
And now force certain types of imaging studies to be done if we cannot exclude that as a cause of the pain.
It has more to do with making sure that you make a process that doesn't allow this to be missed.
And through that process and into development, we have, over the period of about 18 months, 2 years, developed a chest pain center or clinical decision unit where we now, instead of sending a lot of those patients home and just saying, go see your doctor tomorrow or give them a call, we actually keep them around, do further evaluation, and try to pick up more of these diseases.
The Methodist Hospital Chest Pain Center is a 24-hour-a-day, 7-day-a-week clinical decision unit within the emergency department. Experienced cardiac care clinicians assess patients with acute coronary symptoms to prevent inadvertent discharge and minimize unnecessary admissions. Chest pain assessments may include lab work, stress testing, and state-of-the-art diagnostic imaging. The Chest Pain Center provides rapid transfer within the hospital for appropriate testing and treatment as needed.
Since Tyler's death, I know of 5 cases of aortic dissection which were successfully diagnosed in our emergency room and taken to surgery, including one of my own patients.
Education of practicing physicians outside of the emergency room is also important.
If they see an individual in their clinic that has a family history of aortic aneurysms and dissection, that individual needs to be assessed for an genetic predisposition to the disease and has to have aortic imaging. In addition, I would recommend that that individual be seen by a geneticist to determine who else in the family is at risk for this disease. Because once again, once we know this disease runs in families, it's not just the patient the physician who is seeing that's at risk for the disease, but there's maybe many other family members who are at risk. And certainly if the patient has features of Marfan syndrome of low estates, that they need to think about imaging that individual with or without a family history.
Also spreading the information around to other facilities in the area and the region. Make sure that everyone is aware of it, even though they haven't experienced the tragedy that we did.
It's a terrible tragedy and a loss for the family. We're all family members. We have children, we have brothers and sisters and parents, and when things happen, of course, the first thing you think about is how would that, the terrible loss that family is experiencing.
Still reeling from the unimaginable loss of Tyler, the family faced a chillingly familiar health crisis just days after his funeral. Upon returning to his home in Atlanta, Marcus, Tyler's older brother, began to experience chest pains.
His dad took him to the hospital there where he had his surgery and ran into similar circumstances there because he asked for a CT scan and they didn't want to do it.
I said, I think I'm getting an aortic dissection, and she said, no, you're too young for that. I said, listen, my brother just died, my uncles died, my cousins have died, my dad's had it.
And Terry pretty much demanded that they do it.
I buried my brother a year ago from the same thing, and I just buried my 19-year-old son, and that we were going to run that test.
Then they did the CT scan, and they could really, that gave a more in-depth view of the aorta, and they could see there was a ballooning effect on it.
Because of Tyler, we were aware of it, and that may have saved Marcus.
If we can learn anything from Tyler's death, it is that family history cannot be discounted.
The advice I would give is don't leave the emergency room until the imaging is done and the physicians can assure you that there is not an acute aortic dissection.
Significant progress made by Dr. Milowitz and her team into the genetic mapping of aortic disease and identification of biomarkers has raised hopes that a simple blood test to speed diagnosis of aortic dissection may become available in the near future.
We can do all the research we want to do and come up with new therapies and new imaging, but unless physicians stay on top of the progress of the research, that doesn't get translated into the clinical care of these patients. So part of our center is not only to do the research and come up with better ways to diagnose it, follow the disease and treat it, but also to get out and educate physicians on the management of this disease.
We hope never to miss this particular process in a young person again. And hopefully the new protocols will allow us not only to prevent it from happening here, but help other people prevent it from happening at their institutions also.
You know, of course, losing a child to this and very nearly losing another child to this, we want to see an end to it. We want to see the research completed, and we want to have, you know, as many lives saved as a result of this.
This program is dedicated to the memory of Tyler Kahle, with the hope that his story will raise awareness of aortic disease and, in turn, save lives.